Doctors of Reddit, what's the most incorrect patient self-diagnosis you've seen? Late to this, but my friend has an incredibly tough, alcoholic grandma. She ignored a stroke because she thought it was a hangover. Dang, that grandma must have had some rough hangovers. Saw a patient last night who had been having episodes of wind for 6 months and had come in because of a particularly bad bout. Massive heart attack with crescendo angina over the preceding year. Not that uncommon a self-misdiagnosis, but kind of takes you aback when you see it. Fart attack. Not a doctor myself. My grandfather was a doctor and had a patient come to his office complaining of a slight headache. His receptionist told him to wait in the waiting room. They called his name, but the guy never came up to the desk. He actually suffered a major brain hemorrhage, died waiting to be seen in the chair. Dang, that sucks. So close to help yet so far away. Man who rode his bike, a sole method of transportation, came in for chronic knee and leg pain. He had metastatic prostate cancer with bone lesions all over. Came in for my legs hurt, left with hospice referral. As a paramedic, I responded to a dispatch for a sick person. When we arrived, this old guy was clearly having a stroke. He said I just ate some bad fish or something before taking a 3-hour nap. Luckily, his wife finally decided to call 911. That would have made a funny tombstone though. I just had some bad fish or something. I personally knew a guy who was diagnosed with lung cancer in college at the age of 22. He was so young and lived a clean life, so it was confusing to everyone, even the doctors. They progressed very quickly with the treatment, and he was scheduled to start chemo. He was doing some sort of pre-diagnostic meeting, and an intern was involved. The intern started asking some very different questions, and he eventually asks the patient if he had been in Kansas recently. It turned out he had, in fact, spent the previous summer working in Kansas. This was a few weeks after. It turned out the intern had been writing a paper specifically about localized diseases, and there was this disease in Kansas that he had focused on. It had something to do with hay, but it wasn't hay fever. The intern was basically telling the doctor to humor him and run this one specific test. The doctor agrees, and the test comes back with results that show the intern was onto something. The patient went in for chemo treatments with a grim outlook, and he left with 10 pills he had to take over the next 5 days. 1 week later, he was completely fine. For what it's worth, this was in the year 2001. Not a doctor, but a psych first responder. Patient self-diagnosed as dead. EMTs didn't believe him. He was quite insistent though, and wanted an ambulance ride because he thought a dead person ought to have one. The EMTs argued with him, stating that he was both standing and talking. He countered that he was in heck. In fact, he was just pretty high with a bad drug combination. I had a fun hour with him while he came down. As a medic, I had a soldier run up to me and demand to see the PA. When I asked why, he said his girlfriend has BV and now he's sure he does too. I assured him that he most certainly did not have bacterial vaginosis. I'm not a doctor, but I am a medical professional at a hospital. Patient came in stating that he had blood in his stool for almost a year and was convinced that it was just because of hemorrhoids. He only came in when he started to get abdominal pains. Turned out to be colorectal cancer. Moral of the story is, if you have blood in your stool, especially dark colored, don't ignore it. I have had an unbelievable amount of patients who think they have Stevens-Johnson syndrome. Thanks WebMD. When they in fact have contact dermatitis from new lotion or laundry soap. I also advise not looking up that condition. For anyone curious, SJS basically makes your skin fall off. 10/10 would not Google again. Elderly man with dementia brought in for suspicion of toxic epidermal necrolysis, a serious and life-threatening reaction where your skin peels off in sheets. Nope. It was a very large burn because they left grandpa alone at the house and he spilled a teapot on himself and the family, and another hospital were too dumb to figure it out. Tale as old as time. If I had $1 for every patient who thought dermatitis from laundry soap was SJS, I wouldn't even have to work anymore. I was rushed to the ER as a kid because I woke up and my face was blue. Obviously my parents thought I wasn't breathing. I'm 8 or 9 years old, and everyone's sudden change in demeanor is making me a little scared, and I'm just getting bluer. At Emerge, they're running all kinds of tests that aren't showing anything wrong with me, until finally my dad realized that I put the brand new Toronto Maple Leafs pillowcase I just got on my pillow. Washcloth later, I was all better. At least it was a really nice blue. He had some belly pain and thought he had a UTI. Also had weight loss, night sweats and some other stuff. He had terminal pancreatic cancer and 2 weeks later he is delirious and at death's door. I want to upvote you and downvote the cancer. I'm so sorry. Not a doctor, but I am a nurse. I recently had a patient who claimed that he used to have diabetes, but Jesus cured him of it. His glucose was nearly 300 on admission and he was in the hospital for an amputation of a gangrenous toe that didn't heal because of said diabetes. I'll never forget the doctor's note that said patient had a history of diabetes but states Jesus healed him of that, but since his blood glucose was 289 on admission we will treat him as if he were a diabetic. I'm not a doctor but I am a medical assistant. I did my preceptor at a kidney and hypertension center. Had a guy come in complaining of painful urination and thought he had a UTI. Gave him a cup and told him to pee and set it in the window. The lab took the cup and immediately brought him back to a room. Which was strange BC this place stayed packed and it was all first come first served kind of thing. Well, this guy went back BC there was blood in his urine. A lot of it. This guy was beyond 300 pounds BTW. Just massive and extremely tall. Doctors got him in the room and stayed for maybe 15 minutes before we had him transferred to the ER. Apparently, he had a fractured penis and had no idea. The nurse above me said they lifted his gut and his entire groin was purple and black and his penis was at a weird, swollen angle. She said she'd never forget it for the rest of her life. The guy never did tell us what happened or anything. He acted just as surprised as everyone else. TLDR, UT turned out to be a broken dong. I would say after a couple years working in an emergency room before and during medical school that by far the most common egregious self-misdiagnoses involve pregnancy. Tons of sexually active patients coming and complaining of morning sickness and gaining weight, and just sure they have some sort of GI issue or infectious disease. When it comes around to asking questions, oh yeah, come to think about it I haven't had my period in 3, 4, 5 months. That's not to mention the people coming in fully in labor and delivering in the ED. Truly shocked that they were pregnant at all. Now I understand people can have irregular periods and there are many cases where the patient is reasonable in not guessing what's going on. But there is a large group of patients who missed a lot of obvious hints. Denial ain't just a river in Egypt I guess. And I do have empathy for patients in situations where they really don't want to be pregnant and so perhaps are subconsciously blocking it out of their mind. But a medical mystery it is not. Not a doctor but is somewhat related. This one night I started getting some excruciating cramps that were so bad I had to wake my mom. She asks me where the pain was and I pointed out the right side of my stomach and instantly she tells me to get in the car and we go to the ER. She thought I had appendicitis. We get there. I'm hooked up to morphine and they get an x-ray. I didn't have appendicitis. I just had to crap real bad. Opposite here. Woke up and asked my mom to go to the ER for stomach pain I'd been having for hours. She said no, it's rude to go to the ER with a tummy ache. We finally went in the morning. I would have done the told you so dance if my appendix wasn't killing me at the moment the doctor announced my disclaimer. No two people, a good friend and my sister's fiance, who complained of backaches, like they pulled a muscle. Pancreatic cancer, went from pain to them passing away in less than 90 days. This thread is giving me paranoia. I once thought I had a perforated colon because my poop was bright red. I spent an hour on the toilet in pain googling symptoms and then I remembered I got high the night before and crushed a bag of flaming hot Cheetos. You swear you're crapping out your intestinal lining, then realize it matches your fingers. Okay, so why do you think you have glaucoma? Well, back in 2002 I got shot right here, and it was a Glock. I'm not creative enough to make this crap up. Okay, that's amazing. Like it's borderline dad joke. I had a very nice gentleman come to the ED with severe weakness, going on for weeks. It all started with chest pain a couple of months earlier. He thought he was having heart trouble, and he knew you take aspirin for a heart attack, so he took a couple aspirin every day for the next few weeks. The pain got worse, and also started affecting his legs while walking. Then the weakness started. Then he pooped blood, a lot of it. That's what prompted the emergency department visit. When I checked his labs, his HGB was in the 4 range, which is low enough to make me raise my eyebrows. Normal is 13-15. You'll start feeling weak, tired around 10 usually. So his symptoms, including chest pain, weren't from heart trouble, they were from severe anemia. Turns out he had a small bleed from his colon, and taking aspirin, which thins your blood and makes you bleed more, turned it into a large bleed. So I get him tanked back up with blood. We do a few tests including a colonoscopy to see why he was bleeding in the first place, and whoops, we find locally advanced colon cancer. Thankfully it hadn't spread anywhere, so he eventually ends up getting surgery and chemo, and last I checked he's doing great. So this guy was incredibly lucky. By misdiagnosing himself with coronary artery disease, he took a totally inappropriate medication, which caused a side effect that set off a chain reaction that led him to me, and his diagnosis with cancer at an early enough stage to be cured. If he hadn't taken that aspirin, that cancer could have sat another year or two undetected and continued to spread, at which point it would have been incurable and he'd likely be dead right now. A wrong self-diagnosis that turned out to be a good thing. We don't read those very often. When my husband was 8 years old, he complained about having intense pains in his stomach and became so lethargic that he couldn't be woken up. His doctor said there was nothing wrong in that. He had growing pains for 2 years. It turns out his gallbladder had stopped working and would only function correctly a few days out of the month. After the doctor refused him a referral to another doctor for a second opinion, his mom took him to the emergency room and within 15 minutes he was going into surgery to have his gallbladder removed. To top it off, they jam-packed him with so many pain meds that he became so constipated and he couldn't use the bathroom for 2 weeks. He complained about his stomach hurting again and the nurses never once asked him when his last BM was, claiming that they forgot. He had to receive an additional surgery later that week in which he had 15 pounds of fecal matter removed from him. Talk about a crappy time. I forgot to pay the hospital bill. Not a doctor, but I did this to myself once. I was in high school, walking to class when I got a sudden sharp pain in my foot. I was running late and didn't have time to deal with it right then, but I only really felt it while I was walking. It faded quickly when I was still, and even then it was minor enough that I figured it would go away on its own. After a couple of weeks of dealing with it, I mentioned it to my mom, who thought it might be gout. I was a really lazy kid, so it was a definite possibility. We go to the doctor and he does an x-ray and it turns out I broke one of the bones in the ball of my foot. In short, I broke my foot and tried to walk it off for 2 weeks. Pediatrician here. A lot of parents come in thinking their child has cancer because they won't eat anything. Actually, they just don't like vegetables and are eating themselves to obesity with the crap you substituted with. Or the parents never learned how to properly cook vegetables and make them not taste like plain butt. I didn't like most vegetables until my sophomore year of high school because that was when I learned how to cook them myself and actually use, gasp, spices and crap. Physician assistant that works in the emergency department here had a woman, around 45 years old, come in with her mother for a complaint of a spider bite to her back. It was actually an abscess. No big deal. That's pretty common. People think abscesses are spider bites all the time. I incised and drained it and sent her home on antibiotics. Pretty standard procedure. I told her to come back in 2 days for a recheck. When she came back it was looking better. She and her mother thought it was something serious because it still wasn't all the way gone yet, but it was healing well and there wasn't much to do. She and her mother came back again another 2 days later and told me it was definitely gangrene. I tried to reassure them, but they both kept arguing with me that I didn't know what I was talking about. It was obviously a healing abscess and was looking a lot better. Looked nothing like gangrene, which they had googled. Had to get 2 of my colleagues to come in the room to reassure them, but they still didn't believe us. Think they ended up going to another hospital. TLDR, woman came to the ER 3 times for an abscess she thought was gangrene. Not a doctor, I was the patient. Got incredibly drunk one night and decided to finish off the night with an amazing Taco Bell feast. Woke up the next morning with an incredibly bad stomach ache. This continued for about 3 days and I was constipated the whole time. My roommates, all pre-med or nursing, thought it was just the Taco Bell causing some issues, but on about day 4 I couldn't take it anymore and had one of them drive me to the hospital. He continued to call me a B and said they are just going to tell me to take laxatives. While at the hospital they noticed my appendix was incredibly swollen and about to burst and was rushed into surgery. On my way to surgery a doctor came running and screaming to stop and he showed the x-ray to the surgeon and they decided it wasn't the appendix that was the problem but my intestine. Somehow my colon folded into itself like a sock and causes incredible swelling and build-up. Ended up going on antibiotics and morphine for a couple of days and got to miss all my exams. Other than anatomy, the dickhead made me take a longer, more difficult, and extended response-only exam. I have no idea how this happened and the doctors tried explaining the possibilities but I was too fricked up on morphine to understand. I remember them asking me if I recently went to Haiti or the doctor. About 3 years later I started to have similar pain and went to the doctor immediately and this time they just took my appendix out. TLDR. Thought I was constipated from Taco Bell. Doctor said my appendix was about to burst. Then another doctor stopped me from going into surgery and said my intestines folded into each other. That sounds incredibly painful. Missing exams is just a cherry on top. I may have told this one before. Morbidly obese lady terrified she had a lump in her breast. Demanded to be examined immediately. Rib. Schizophrenic guy thought his lungs were rotting but it was okay because he'd just get a new torso from NASA. He's not even American. I don't know why NASA would give him said non-existent torso. Also I'm not really sure what sort of official organization would give out torsos but I'm not convinced a space agency would have been my first choice if asked. Psychologist here. Saw a leathery woman who drank 3 pots of coffee a day to cure her anxiety. Wish all problems were this easy to fix. My grandpa was drinking 6 pots of coffee a day in his late 40s and started having heart problems. It was skipping and he felt weird. Eventually the doctor got him to cut down to 1-2 pots a day. Mother brought in her 3rd child. Kid's listless, pale, muscle tone is poor. Mother claims kid has MS. So doing my checks asking about food and home environment. Mother tells, oh little kid is lactose intolerant so we only use almond milk. Run a panel. Not only is the poor little 2-year-old not lactose tolerant dumb but mother has been starving his poor brain of nutrients by feeding him only vegetables. But no protein or protein based items like legumes. Kid is developmental delayed because she saw an internet article on it. Ended up calling CPS on the B and having all of her 3 children removed. Had a daughter with bulimia. It was horrifying. Still pisses me off when I think it about. Good on you for calling CPS. I'm not a doctor, but when I went to see a physician a year back for my shaking problem, I have severely shaking hands. I was told that it was a short-term problem that would likely go away in my late 20s. I told him I was on medication, and he dismissed it as an unrelated issue. Recently, I went to a different doctor. He assessed my symptoms: jolting limbs, twitchy face, shaking hands, locking jaw, etc. Turns out I have tardive dyskinesia, which is a very rare side effect of one of the medications I was on. It is irreversible after age 25. If I had listened to the first doctor, I would have permanent brain damage as young as 25 years old. Not a doctor, but I went to the hospital about 5 weeks ago with what I thought was testicular torsion. I got told it was orchitis and was prescribed antibiotics for a week and was told it would feel better within days. Pain got worse and so did the swelling. Turns out it was testicular torsion and was operated on and sent home without my left testicle because the doctor was so certain it was just an infection and didn't feel it was necessary for me to have the appropriate scans to double check. Which I'll later get told that it should have been the first thing he should have done in the first place. So now I'm 20 years old with a missing testicle and about a week now from full recovery. Frick you Dr. Singh, you incompetent Wankstein. Well, now others can avoid him. Thank God he doesn't have one of the most common last names in the world. Not a self-diagnosis, but I had been seeing various doctors for months with what they thought was post-viral syndrome or depression depending on how the doctor felt that day. Then after being out in the sun one day I developed a malar rash and my husband decided it looked like something he had seen on a medical program called lupus. Doctors laughed me and him out of the consultation room for months. I was too young, not the right race, no family history etc. etc. Turns out they decided eventually to order the right blood tests and I have lupus. I do love doctors, but realize now that often their guess is as good as mine. Ever since house, people self-diagnose lupus a lot. Congratulations on getting it right. Not a doctor, but a doctor diagnosed my wife with a STD. Chlamydia maybe. Huge fight. Wife was emotionally crushed. She accused me of cheating. Fricked up. I punched her symptoms into WebMD and told her it was probably kidney stones. Turned out to be kidney stones. No a doctor but a pharmacy technician. Had a patient yesterday tell me they went to urgent care and the nurse diagnosed pink eye. The patient didn't feel right about that and went to the eye doctor. Eye doctor told her she had an ulcer on her eye and if it went untreated properly she would lose eyesight and possibly the eye. I went in a boating trip off the coast of BC. We went through various small channels of water and docked somewhere where we could go kayaking on the open water. We took turns managing various aspects of the ship, doing menial tasks such as watching for logs or otters and crap in the water that might frick up the propeller, or helping out in the extremely loud engine room. This was over the course of maybe 3 weeks. On the last day of the trip everyone started to get seasick, myself included. We flew home the next day, and when we landed I felt fine. For maybe 2 hours waiting in the airport and driving home I started to feel worse and worse. To the point where I was laying in the back seat of the car and we had to pull over maybe 50 feet from my house to let me throw up. I had had migraines before and it felt just like one. Fast forward to later that night and it was so bad. This migraine that even the little light coming in from the slit under my door caused incredible pain. We went to the emergency walk-in. The whole time I was there I had to have my right eye covered or the pain would overtake me. They prescribed something. I can't remember which, but it had no effect at all. The next day the pain was still there. So bad during the day that I actually tried to claw my eye out whilst trying frantically to get a hold of my parents to take me to hospital. Once they finally took me to hospital they admitted me and took me in for a CAT scan. They found that I was suffering from sinusitis. This sinusitis had led to pressure on my optical nerve, which in turn caused a blood clot to form. I was in hospital for 2 months, under strict quarantine whilst the doctors pumped me full of blood thinners and an antibiotic concoction that they made that killed all my white blood cells. When released, they had me outfitted with a pump that pumped medicine through my arm and directly into my heart through a vein. I don't think anyone could have caught that diagnosis from light sensitivity and a headache, but I'm awfully glad I went to hospital, and that the children's in that city is one of if not the best in the world. The trip itself cost about $8,000, and the treatment probably far more. Thank God I live in Canada. I fell rock climbing directly on my knee, immediately went to the emergency room. I knew it was bad, where they took an x-ray and told me I dislocated my knee and that I might have a small fracture but it didn't look like a big deal, and to go to an orthopedic in the next week or so. No prescription. They suggest I take Tylenol for pain. I went to an OS later that week who immediately put me on painkillers and got me in for a MRI the next morning. Went back the next day and I had a very seriously broken tibial plateau, basically where shin meets the knee. Completely torn my ACL, PCL, LCL and meniscus. He rescheduled a surgery to get me in ASAP to place my knee with a plate and 8 screws. Had another surgery 6 months later to fix everything else. My medical moral of the story is generally if something feels really wrong, something is probably really wrong. If you are new to the channel, you can subscribe. I publish new videos every day. Until then, check another video. Bye for now.